This is my series, Living with Long COVID. Today we are going to be discussing hypermobility and EDS. EDS stands for Ehlers-Danlos syndrome. Ehlers-Danlos syndrome is a group of connective tissue disorders which are characterized by a defect in the synthesis of collagen. That's a crucial protein that provides strength and elasticity to various tissues in your body. Connective tissues include your skin, your joints, blood vessels, and internal organs. There are 13 types of Ehlers-Danlos syndrome, and 12 of them have genetic links. The final type of Ehlers-Danlos is hypermobile Ehlers-Danlos, or HEDS, and they do not currently have information about a genetic link. People who have hypermobile joints but who do not meet the full criteria for HEDS are classified as hypermobile spectrum disorder, or HSD. Ongoing research aims to support the observation that individuals with EDS and hypermobile joints are more likely to experience persistent symptoms after COVID. I want you to know that we are going to be talking about all of these concepts because for management of long COVID, you need to know, identify, and manage each of these symptom types. Not everybody that has long COVID is every single symptom type, except for if you are a Dorothy, then you automatically have to manage everything. How do you know if you have EDS? The red flags are that you're flexible or double jointed. So the questions I have here are, have you ever done party tricks to show how hypermobile you are? Have you ever been able to do the splits? And then it can also change the integrity of your skin. So you're more likely to have a hernia or prolapse or stretch marks and things like that. I have listed down here the generalized joint hypermobility criteria. That's criteria number 1. I am looking for anybody that falls under this category, and it has the button right here. The button is where you're going to move your fingers, your elbows, your knees, and see if you've got more than 10 degrees of overextension through those. The last criteria, which is right here, touching your hands to the floor, that actually has a little bit more to do with hamstring length, which is a muscle, than it does to do with hip hypermobility. So that's why knowing about the splits, or if you've got hip joints that go in and out, that's actually a better judge of whether you're hypermobile through your hips. The other thing is that it doesn't judge shoulders. So if you're able to do something called the reverse namaskar, where you basically are touching your palms together behind your back, that shows a little bit more shoulder hypermobility. I've got the criteria, the full criteria right here in the QR code. So feel free to link through that if you want to see all the criteria. So people that have EDS are called zebras. And if you didn't know that you are a part of this club, then welcome. This is a poorly understood condition. I live in the Kansas City metro area, and even though it's a bigger city, there's not many people here that are knowledgeable about EDS. I really recommend that you join your local EDS group, and you basically can ask for the names of doctors, geneticists, rheumatologists who might be able to help diagnose with Ehlers-Danlos syndrome. The top things that I want you to know if you have EDS is that your system is especially sensitive and it reacts and overreacts to many types of triggers. If you have a connective tissue disorder like EDS or hypermobility, you must be extremely diligent in your health management because you've got the hardest and longest road to walk down. You also need to make sure that you are not vitamin deficient because that will really worsen any pre-existing or conditions that you're prone to. So check your vitamin D, your folate, your B12, and homocysteine levels. Hypermobility and MTHFR gene mutations are highly correlated, and those nutritional deficiencies are associated with them. Number 2, act like you have POTS and MCAS pre-diagnosis. So again, when I was talking to you about the Dorothy, you have to walk every single character down the road the right way. It's because you're especially prone to MCAS and POTS. So we're just going to act like you have it, basically, if you have hypermobile Ehlers-Danlos or a connective tissue disorder. The last one is that you need to pull yourself together literally and put a team together. So instead of stretching, we basically want you on a strengthening protocol, and you need to do that consistently, basically for the rest of your life, because your muscles help to hold your body together. Correct breathing practices are also extremely important. So contract, relax, exercise, positioning, and safe strength training are some of the best ways to help your body. You also need a multidisciplinary team. So that's going to be physical therapy, pain management, and other supportive measures to address any specific symptoms and help improve your quality of life. Just going through some of the treatment that's typical with Ehlers-Danlos, we need to make sure that we're managing your symptoms and improving your quality of life. There's no cure for it. It's your physiology. But you do need to think that, hey, I need treatment plans and I need to really watch these specific areas. And unfortunately, you have to manage kind of a multidisciplinary team with various healthcare professionals. I really recommend, if you have any medical issues, that you get the book Disjointed. It's by Diana Joven, and it just came out, I think, in 2019. So it's very up to date in terms of information about how to medically manage your hypermobile spectrum disorder or HEDS. Again, physical and occupational therapies are the cornerstone of EDS management. We can help with muscle strengthening, improve joint stability, learn about joint protection techniques, braces, splints, assistive devices. If you are doing exercise, water-based exercises and the Muldowney protocol are really good starting points if you're just getting into exercise. Home strengthening programs are something that you need to do consistently over time. So I really like this book for people that have long COVID because it's starting out in supine, it's POTS friendly. It's really easy to modify it so that you are not overdoing it, but you are increasing your muscle strength at the same time. In terms of treatment, also you want to be friends with your orthopedist. They can do orthopedic interventions such as surgical procedures, of course, that's what we think about. But then there's also just things like shoe inserts, bracing, splinting, that they may be able to give you some information on. Individuals with certain subtypes of EDS, particularly vascular EDS, might require regular cardiovascular monitoring. Mitral valve dysfunction is pretty common. So, if you have the opportunity to do an echo or something just to rule out these conditions, or if you start to have any heart issues, make sure you get that checked out. There is a lot of psychological aspects of living with a chronic condition. So counseling, psychotherapy, or support groups can help you with emotional support and coping strategies. And then pain management. So we want to make sure that people are on appropriate pain relievers. Opioid medications are really best avoided in this group because that does slow down your GI tract and that can increase issues with digestion. And then also there's some vitamin and mineral deficiencies that can imitate depression and anxiety. So examples of supplements that have value in pain management include vitamin C, vitamin D, vitamin B, omega-3 fatty acids, quercetin, magnesium, SAM. So just look into those, please. You should also know things to avoid. So people with EDS are prone to more severe concussions and whiplash. So avoiding activities and sports that have a high likelihood of that, like heading soccer balls regularly, riding roller coasters. You want to avoid too much stretching and too many inversions. And then if you are addicted to your chiropractor, make sure that they're not over manipulating you. So in the case of acute dislocation, that's great. Otherwise, we want to strengthen before we relax. You want to avoid medications and supplements that lower blood pressure or cause dehydration. So that's benzos, narcotics, opiates, stimulants, anticholinergics, alpha receptor blockers, calcium channel blockers, diuretics, MAOIs, and then fluoroquinolone antibiotics, such as Cipro or Levaquin, are also contraindicated. That makes the joint hypermobility worse, so stay away from those. Other things just to throw out there is people that are hypermobile sometimes have differences in terms of their physiology. So if you do have any of these red flag symptoms, we want to make sure that you're getting imaging, especially functional MRI, just to make sure that you're not having Chiari malformation or anything like that. And then you should know your common comorbidities. So unfortunately, you're more likely to have obstructed sleep. So that's obstructive sleep apnea or upper airway resistance syndrome, endometriosis, PCOS, fibromyalgia, all of these listed. And then of course, the trifecta is the most commonly known comorbidities. So that is MCAS, POTS. So walking through this quickly, I really want us to talk about why do you think you might be more prone to long COVID? If we're looking at long COVID, the major findings, mechanisms, and recommendations, we can already see a pattern in which it's hitting on some of your negatives here, okay? Because if your gut microbiome is off, as it often is, or if you've got issues with your endothelium, then that's going to be an issue for you. And then over here, we also have brainstem or vagus nerve differences, which is going to be a higher likelihood in people with hypermobility because you're more prone to injuries. So dysautonomia is one key part of long COVID. About 60% of the people that have long COVID have dysautonomia symptoms. And here are some of the triggers of dysautonomia. All the ones that are in orange are especially relevant to HEDS. So that's going to be mast cell activation syndrome. Basically, some of these compression issues or malformations in your body, these previous viral infections, mold exposure, having an inadequate airway, and then those nutritional things that I already talked about, as well as concussions that you're slow to heal in that. And of course, over here, we already saw that estrogen imbalance is also a common comorbidity. So this is from the Disjointed, the book by Diana Joven, and this particular chapter on dysautonomia is very well done. It's written by a pediatric cardiologist named Maxwell. He's got other good resources available on YouTube and online. So this is part 1. I'm going to take a pause here and then we will start our second video. I'm going to go through the available evidence that we have on long COVID and EDS. It's as up to date as it possibly can be. So stay tuned for section 2.